Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. My name is Annisa Maulidiya Putri. In this video, I will be presenting an article with the title, 8 Things You Need to Know About Face Mask. Next slide, please. So, according to the latest recommendations from government medical agencies, it's a good idea to wear a face mask that covers your nose and your mouth in public. This includes going to the grocery store or any other time when you're not able to maintain the recommended social distancing of at least 2 meters. So the number of coronavirus cases around the globe is ticking up almost hourly, and people are understandably very concerned about catching it themselves. So here's what doctors need you to know about what face masks can and cannot do and how to use them effectively. So I've already summarized 8 points from this article. The first point is a mask is not a respirator. So the masks that you see in the news are almost always a dust mask or surgical mask, not the respirator one. There's a big difference, although they can look very similar at a first glance. A face mask is a loose-fitting disposable device that creates a barrier between your mouth and the external environment. They are not intended to protect you against respiratory illnesses because they are typically meant to prevent you from like dust particles. And then the second one is masks won't protect you from viruses. Why? Because face masks aren't fitted. It means that viral particles can easily get in, under, and around them and end up in your respiratory system. Particles can come in on the sides and underneath and be inhaled, and you can still get exposed from the virus. The third point is masks can leak. This is why viruses can get in, because masks are loose-fitting. So smaller particles like viruses can get through your respiratory system. The fourth point is masks may help stop your germs from spreading. So while face masks won't protect you from viral illnesses, they may help protect others from any respiratory symptoms that you may have. Also, organization does advise wearing a mask if you're coughing or sneezing. Next slide, please. Face masks also need to be used correctly. Even though masks only have limited benefit, but you still need to know how to use them correctly. For masks to be effective at all, they must cover your mouth and your nose, not just one or other. They also don't work if you lift them up to talk to someone or scratch an itch. They're also not intended to be used if you have facial hair. Single-use masks should not be reused, and they should be replaced if they get damp. The sixth point is masks may create a false sense of security. So first of all, masks are not effective at keeping out viruses. Plus, few people know how to use them correctly. People feel they have a sense of protection, but then they do things like touching dirty stuff, then touching their eyes, or even their nose. The seventh point is healthcare workers need more respirator masks more than you do. So respirators masks are flying off store shelves, and that's not good for any of us. Respirators are needed every day in hospitals and are critical during an outbreak such as coronavirus. And then we come to the last point. Washing your hands is better than a face mask. So frequently washing your hands with soap and water for at least 20 seconds at a time is the best way to avoid contracting the coronavirus. So this process of hand washing is more effective than wearing a face mask. Next slide, please. So does this article relate with our current life? For me personally, yes, this article does relate with our current life because in early of 2020, we experienced a global pandemic called coronavirus disease number 19. When it first spread around the world, people went crazy. They were buying face masks until they were flying off store shelves without even thinking whether the mask will protect them or not. Next slide, please. Is So based on this article, we know that a face mask is not really that effective to protect yourself from getting the virus. In my opinion, the purpose of this article is to inform the fact that some people may not already know about face masks, in the hope that people will gain more knowledge about face masks and they will use it more effectively. Next slide. Okay, now we've come to the question and answer session. So to any of you who wants to ask me a question, the time is yours.
Can I?
Okay, Halimatul Sa'diyah.
Okay, so my question is, why does the Indonesian government prohibit the citizen from wearing scuba masks?
Okay, thank you for your question. So the Indonesian government prohibited the citizens from wearing scuba masks. It is because scuba masks are less effective at warding off coronavirus. Scuba mask is a mask that has only one layer, and that layer is very thin, so that the possibility of the virus entering our body is very large. That's why the government prohibited us from wearing the scuba mask. So did I answer your question?
Yes, thank you.
Okay, next question, please.
Putri, please.
Okay, Putri.
I want to ask about how do you respond to a person who wears a disposable mask and use it more than once? Thank you.
Okay, thank you for your question, Putri. So to answer it, we know that using a disposable mask multiple times is dangerous. It is not good for for our health because germs and bacteria are accumulating in the mask. So it is better if we advise the person who use the disposable mask regularly to change it into a cloth mask, because it is more effective since we can wash them and use them again. So is it does the, did I answer your question? Sorry.
Okay, it is enough. Thank you, Anissa.
Okay, thank you. The last question, please, Selfie.
Okay, my question is, when we want to
Sorry,
buy
can
a
you
face mask,
can you it I can hear you properly. Can you speak a bit louder?
okay, okay, can you hear me now?
Yes.
Okay, my question is, when we want to buy a face mask, do we need to pay attention about it, and why?
Okay.
That's it.
Thank you for your question. From my opinion, yes, we have to pay attention to reduce the spread of COVID-19. With so many types of masks, it can be confusing to know which ones are best. However, according to the multiple studies, masks that have two or more layers have been shown to help reduce the spread of COVID-19 by preventing respiratory droplets from traveling into the air. So it is best if we choose the mask with two or more layers in it. Did it answer your question? Did I answer your question?
Yes.
Okay,
Thank
thank you
you.
so much. Thank you so much for your questions. That's it for my presentation. Uh, thank you so much for your great attention. Wassalamualaikum warahmatullahi wabarakatuh.